Hey guys, so today's video is not for little kids, so if they're in the room, either put your earbuds in or shoo them somewhere else. So we're going to talk about how to think about opening back up the economy as like having safe sex. So I am just annoyed by the political divide that's happening and just how outrageous this is that we can't get our act together as Americans. So why is it all or none? Why is it let's wall off and be a hermit for the next 2 years, and then other people just thinking I'm going to throw all caution into the wind and not even take any interventions? And I think it needs to be a blend. It needs to be a balance, because I completely agree. Our area down here where we're at could probably open back up, but we need to do it safely, or else we're going to look like one of the big cities. And so I think this analogy of safe sex is one that we really need to think about. And so here is what we'll go with. So we need to kind of think of COVID as like a chlamydia. Chlamydia is not actually a virus, but most people know what chlamydia is. So we're going to use that example here for a moment. So right now we're preaching abstinence. We're saying shelter in place. And that appears to be making some people furious. It's kind of like preaching abstinence, like most people can't abide by it, and so it only works if you can do it. And it's not effective if you don't do it. And so thinking, COVID's going to be around for the next 2 to 5 years before we really have a handle on it means abstinence is going to be a lot longer, and most people can't tolerate it. Apparently 2 months, 6 weeks is too much for people to tolerate. So what else we need to think about is all this testing and tracing is like waiting for you to get chlamydia. So right now, if someone gets chlamydia, the county nurse calls me and I fax over a sheet that tells when the symptoms started, where they got treated, and where they live, and their phone number, because then the county nurse has to go and find out all who their partners were and talk to them and find out their partners to try to track down all of who might be exposed and who needs to be tested and treated. So that's fun, right? I mean, everyone likes to know, oh, I must have been exposed, and have to get, worry and have that. And the poor person who found out that they were positive feels guilty about spreading it with other people, or at least they probably should when it comes to sexually transmitted diseases and things like that. So doing things like social distancing and wearing a mask and trying not to be out and about unless you absolutely need to is like wearing a condom. It's trying to live, understanding that there's still a risk, but that you're willing to do it as safe as possible. You get to have the fun, but you do it responsibly, right? People that are defiantly not wearing masks, who are meeting in big groups at church, are similar to the people saying, oh no, baby, we don't need a condom. I'm clean. I promise it'll be safe. Yeah, those are the people that come in with chlamydia. Okay. So if you want to get back into living, you need to start thinking of this as safe sex, and you need to start doing the things that we can do to try to limit the transmission, knowing that there is still going to be a risk. So I tell the teenagers that I take care of, never trust the people who say, oh baby, I don't need a condom, because you do, each and every time, okay? While chlamydia is treatable, herpes is not. That's another STD. You're going to live with that one your whole life and feel guilty about all the partners that you potentially give herpes to. So wear a condom when you have sex. Wear a mask, socially distance, wash your hands, and stay away from other people. And if you're sick, you don't go outside, okay? That's what we do for COVID. That's how we learn to move about in this world, to reopen our businesses when it's safe to do so, is by not being defiant, but by being smart about this. COVID doesn't have a treatment right now. We're hopeful, but not yet. And we're all in search of a vaccine. But what if the vaccine isn't perfect? We have some vaccines that are stellar. And then we have some vaccines that work like 50% of the time. And while it's 50% of the time, it's, a coin flip. I'll take my chances, and I like the idea of not getting influenza 50% of the time. What's interesting, yesterday's medical news said probably don't expect a summer lull, which was kind of a bummer for COVID. And then the other medical news from today basically says that cloth masks, when they put them over hamster cages, not that they actually made little masks for the hamsters to wear, had a decreased transmission rate from 66% down to 16% if they were mask wearing. And those were cloth masks over the cage. So it appears to be that cloth masks will actually, probably in the research, actually come out being okay. So don't be the jerk, okay? Don't be the jerk. Wear the condom if you want to be out and about. For COVID, you wear a mask. You socially distance yourself to the best of your abilities. You clean the surfaces you're around as often as possible, and you wash your hands regularly. There are ways to open up businesses smartly. But the more defiance that we have, the more risk we're going to take on, the more cases we're going to see. So if you don't want to worsen the problem, do some things that make some sense. If you have a scratchy throat, if you have a fever, body aches, if you're coughing, don't go out. Get checked out. If you have drainage coming from your penis, you don't have sex with people, you go get it evaluated, okay? Wear a mask. Just like you put on a condom, wear a mask. It's your responsibility as a good citizen to protect the people around you. It is good as a sexual partner to wear a condom for a partner, all right? If you want to play, you have to pay. You have to do the things to protect everyone else. It is not just about my independence, okay? Don't huddle in a group. Stay away from each other. STDs spread. Having more than one sexual partner is a way to get STDs. Staying in a big group of people, standing around chatting away without doing any other measures to keep yourself safe, you will spread COVID, okay? We can do other things. We should be researching and learning about how to purify the air indoors, how to change our ventilation systems to direct the flow of the air in the rooms to limit the spread. We can work on the best surface cleaners. Can we work on ways of cleaning buildings with UV light? All these things we could be researching, but instead we're protesting. Instead, we're filing lawsuits against our government workers. Get to work and start finding us answers to these questions so that we can open up effectively. Why create more problems? Find the solution, okay? We need more cleaning products. We need more access to wipes and sprays. Instead, we're, buying alcohol off of distilleries. Fine, it'll work for now, but help us get more stuff. Stop looking to be the problem and be the solution. So, in closing, wash your hands, wear a mask, stay away from each other. As I teach my kids, no glove, no love when it comes to sex. You should be wearing a mask when you go out to protect those around you. You should have a limited number of partners, okay? Just like sex, have a limited number of partners. Work to clean your environment, work to keep your environment clean and sanitized. And yes, we can open back up, but not with defiance, with acceptance, with troubleshooting, with researching, with figuring out how to do this safely so that the county health nurse doesn't have to track down all the people you've infected, okay? We can do this. We really can. We did safe sex. We went from not wearing condoms to a population that wears condoms quite frequently. We can do this. We just have to be smart about it, and we'll get to open back up. All right, guys. Sorry, this was energetic and a little crazy. Love y'all. Take care.